Hello again, this is ZengoMD. The next in our series of botulinum toxin videos today covers how you can save up to $50 on most treatments by simply knowing more about how botulinum toxin works than most providers do, and using that knowledge to save yourself money instead of padding their pockets. Please keep in mind, though, that during this video, when I mention Botox, Xeomin, Dysport, and Jeuveau, these are all the trademarks of their respective manufacturers. First, here's how not to save $50. Don't hunt down the lowest per unit price. And if you don't believe me, then watch our video on botulinum toxin ripoffs and see how easy it is to dilute the active ingredient and how often mistakes happen in larger med spas with multiple injectors over the week. Med spas with inexperienced practitioners and revolving door staff that works for minimum salary will always give you a worse value due to poor technique, imported toxin, and dilution. Sales and specials? Forget it. Stick with providers that have an everyday low price. This is a medical procedure. It's not like marking down all the winter coats in April. Botulinum toxin has the same value every day. It doesn't change. Going to a place that has a special today means that you're probably overpaying for the watered down stuff today, and then you'll probably get an inexperienced treatment next time when they don't have a special and pay more. So here's what you can do to save that $50 and still get a great treatment all the time. First, joining the manufacturer's rewards program is a must. Don't overdose because it doesn't make it work better or work longer, and we'll give you some ideas about where you might be overdosing and help you save some money. Don't do very low quality areas where botulinum toxin is not the best treatment for the wrinkles. Don't chill or even touch the sites after your treatment so that the toxin you get works better. And finally, get your repeat treatments on time to prevent the wrinkle creating muscles from ever getting back to full strength. By far, joining and participating in the manufacturer rewards program will get you half of that $50 each treatment. I know a lot of you don't want to give out personal information to big companies, I get it. But these programs don't spam you and sell your information to third parties. In fact, they exist not really to spy on you and your habits, but to spy on us, the providers. And rightly so. See, in order for us to award you the points for your treatment, we have to buy the genuine product from the manufacturer and report the lot number back to them. Because if we don't, or the lot number's from another country, the manufacturer will quickly cancel that practice's right to give points. This increases the likelihood that you're receiving genuine product that was properly handled en route to the office. Check out our botulinum toxin ripoff video for more on that. Also keep an eye out for bonus points that are awarded when, say, toxin and dermal fillers are performed at the same treatment. A little time working to manage your rewards account, log in every 3 months, can put a couple $100 back in your pocket each year. Next, only do the best locations and diligently work to find the lowest effective dose for each area. Dosing botulinum toxin is like the pole vault. Each muscle has the bar at a different level, and you don't get extra credit by clearing the bar by 3 feet. And there's no partial credit if you jump high but not high enough. With that said, let's look at different areas so you can find out how you can save on units. And you as the patient should get involved with your dosing. I mean, this is not like chemotherapy or an antibiotic where the providers always know the right dose. The patient should be involved with their toxin dosing, and often my patients make very good suggestions because they're the ones who see how the toxin takes effect and how it wears off over the 3 months. And that is why we're going to present the next section. So I've injected over 300,000 units and have trained hundreds of providers. I've read just about everything in the literature regarding using toxins for new areas. And I've come up with a quality star rating for each major area of the face. Here, the first cosmetic botulinum toxin treatment to be FDA approved back in 2002 is the glabella, or the 11 lines in the central brow. It's the true 5-star treatment, giving predictable results with few side effects when performed by an experienced injector. Also, the dose for this area rarely varies from the 20-unit FDA indication. There's a possibility that you could save some units if your central brow is weaker than most people and the ends of your muscles here are not moving. In these special cases, I've had some good success using as little as 12 units for the central brow. So if these red X areas don't move when your botulinum toxin is worn off, then consider this dose decrease. And as usual, if you get a full 3 months of coverage from the 20 units, then adding more will not extend the results. The next 5-star area is the crow's feet lines that fan out from the corner of the eye. This involves blocking the orbicularis oculi muscle that encircles the orbit, but does not do anything for blinking, winking, and eye movement. The FDA indication, which applies only to branded Botox, is 24 units. If you are getting 24 units or 12 on each side, and when it wears off, you don't see lines pointing upward, downward, and sideways all at the same time, then you can consider reducing your dose next time. to possibly as low as 8 or 10 units per side. Also, if you have asymmetry between each side where your crow's feet are, then you can always try reducing the number of units on the weaker side. The final 5-star area is the upper forehead lines that run horizontally. This was FDA approved only for branded Botox in 2017. However, the dose in these studies used was 20 units. I found this dose to be a little too high for many of my patients, who often lose too much lift and movement in their forehead at that dose. My dosing averages 12 to 14 units per patient here. Remember that the goal is not complete blockade, because in order for the forehead to lift the brow, we can't eliminate all the tone in the frontalis muscle. Plenty of things you can do here, including doing asymmetric treatment when indicated. So consider reducing your forehead dose by a couple of units next time, especially if your last treatment felt too heavy or frozen. Now we get into the 4-star treatments. None of these are FDA approved indications, but are legal to perform by experienced providers. Still, these areas do not give the same results in all patients, and while they use few units, they might not work well at all. The biggest issue with the brow lift is the misleading name. See, botulinum toxin relaxes, not lifts, so treating here relaxes the downward pull on the lateral brow, which may allow the frontalis muscle, if untreated, to lift it. While the treatment for the glabella, when placed properly, can raise the medial brow as well. At most, though, this effect is only going to be 1 to 4 millimeters. If that's not worth it to you, then save your money here. The nasalis is a small muscle that causes wrinkling around the bridge of the nose, usually when people smile and laugh. It takes a few units and usually works well, but the muscle is very small and requires some very precise placement. The DAO is a muscle that can pull down the lip corners, and it can be very effective, but if you have shadowy tissue loss in these areas, then it won't do much of anything. Dermal filler would be a better option, since botulinum toxin doesn't fill where there is tissue loss. Therefore, this is only a 4-star treatment, since some providers are quick to recommend it when the patient would benefit from another treatment that requires a different skill. Every other cosmetic use of botulinum toxin I consider to be 3-star treatments or less. This is because they can either use a large number of units for minimal effect, like the face slimming treatments and the neck muscle bands, large muscles and large coverage areas that require a lot of toxin, and often these areas are underdosed and the patient sees very little results, even after a 20 or 30 unit treatment. Around the upper lip area, lip flips and treating upper lip wrinkles can also be very unpredictable, especially if you enjoy drinking from a straw, whistling, or saying the letter O. Wrinkles around the mouth are not caused by too much muscle movement. They're caused by loss of volume over time. This is best treated by creating new tissue with modalities like PRP, smooth thread PDO filler, and dermal filler agents. Again, experience matters here, and if you have had good results in any of these areas with botulinum toxin, make sure you know how many units you got to achieve those results again. Next, to get the most bang for your buck, you want the toxin to get taken up by the right muscle quickly and not get washed away. This means precise placement and low volume reconstitution, which we discussed in our botulinum toxin ripoff video. But what can you do? Choose a provider who helps to spread the toxin around in the muscle instead of just ushering you to the door quickly at the end of the injections, leaving the little whelps of Botox untouched on your face. In my career, I've always made it a point to place the toxin in the center of the muscle and then immediately massage it up and down in the areas to be treated before you leave the office. This helps to reduce the risk of migration of the toxin to the wrong muscle or the toxin being washed away. Also, chilling the muscle before and after treatment does not help. We don't chill anything, and I've yet to meet a patient of mine who says the pain of injection is not worth the wonderful effects for 3 months or longer. Proper distribution into the muscle can give you an extra couple of weeks of effect down the road, so why not take a few minutes and do things right in the treatment room instead of taking chances later. Our last way to help you save $50 per treatment is sticking to a proper schedule. You get the benefit of natural wrinkle relief 24/7, 365, and an additional benefit in year 2. Here's a typical person who gets 2 treatments for her glabella a year and then lets it just wear off. 20 units at $12 a unit. So they get a treatment in January and get covered through April. Then their wrinkles return. Then they get a second treatment in the summer only to have the wrinkles return again for the fall and winter. First of all, the whole world knows when you're getting your Botox because your face is constantly changing. And isn't that what we're trying to avoid? And continuing to age when the Botox is not on board for those 6 months. So you're not doing a very good job of stopping or slowing down the biological clock in the long run. In this case, you're getting seamless coverage, which does not wear off, and you're still only spending $80 per covered month, but it looks great all the time. And then in year 2 comes the benefit. See, by not letting the glabella muscle regain strength, It is similar to when your arm or leg is immobilized by a cast. When the cast is removed, other than looking all hairy, the muscle is small and weak from inactivity. That will also happen to your glabellar muscle, and that's okay because it has no function other than to cause wrinkles. So in year 2, we found that you only need to get treated 3 times 4 months apart, using the same number of units and the same cost. This saves you $20 per month or $240 over the entire year, and you still get great coverage. So remember, when it's time to treat an area, if you do it for a year on schedule, then you get a bonus in year 2. So that's it for us. Please subscribe because you never know what kind of video we're going to do next. And check out our other videos on aesthetic procedures and botulinum toxin as well. We'll see you next time for another controversial video about aesthetic or wellness medicine. Bye.